Hello, everyone, and welcome to day 2 of the 2021 Planetary Health Annual Meeting, co-hosted by University of Sao Paulo and the Planetary Health Alliance. I am Jeremy Pivor from the Planetary Health Alliance, also referred to as the PHA. We are so pleased to have you join us at our 4th annual meeting and our first virtual meeting and festival. We are thrilled that there are over 4,600 people registered for the conference from 128 countries. Truly a planetary event. Yesterday, we had an extraordinary start to the annual meeting where we explored the theme of foundational values for planetary health through an amazing keynote, panel, interview, and lightning talks. It was a day of deep reflection to explore, recognize, and acknowledge the values we need to achieve the great transition. These values must draw upon indigenous wisdom and traditional ecological knowledge, world religions, and faith traditions. It can help us enhance our relationships with ourselves, each other, and the world in which we are a part of. Our last panel filled us with hope that by following these values, improving justice and equity, and being stewards of nature in our communities, we can flourish and find true happiness. We can find meaning and purpose, and we can develop connections across diverse communities, cultures, and geographies. The richness of yesterday's discussion is impossible for me to capture in words. So fortunately, all the sessions were recorded and will be available to you on the PHA YouTube channel. Yesterday's conversations on values lay the groundwork for our discussions today, which all revolve around knowledge for planetary health, fostering science, technology, and education. But before I end, I want to remind you of a few exciting PHA program launches and housekeeping items. As of yesterday, individual membership in the PHA is now open. All individuals above the age of 13 are invited to join the Alliance, which you can do through our brand new online members community on the networking platform, Hilo. On Hilo, you can easily join any of the new 10 PHA regional hubs. Members can easily join other PHA communities on Hilo, such as Clinicians for Planetary Health, Education, and the Next Generation Network for Youth Leaders. Our hope is that these new opportunities and resources will help to bridge communities to achieve the great transition. You can learn more at the PHA booth in the exhibit section of the main event hall. Please also consider adding your voice to the Sao Paulo Declaration on Planetary Health Global Consultation. This declaration will be the first document of its kind from the planetary health community, outlining what actions are necessary to achieve the great transition. Your contributions will serve as a call to action for the global community. You can join the consultation on Spark Blue, hosted by United Nations Development Program, by visiting the Sao Paulo Declaration booth in the exhibit hall. Also visit our other partners in the exhibit area as well. They have a lot of wonderful information and offerings. We are grateful for all their collaborations. Finally, remember to check out the side and festival events that are happening before and after the main sessions and science lightning talks. So many groups from around the world have contributed their time and effort to engage us in important planetary health conversations and art. Please join them. So now, I'm very pleased to be introducing our first panel of the day entitled Planetary Health, Transdisciplinarity, and Academic Careers. New structures for a new science and education. I'd like to briefly introduce our moderator, Antonio Saraiva. Antonio, chair of this Planetary Health Annual Meeting and Festival, is an electrical engineer and agronomist. His transdisciplinary research ranges from bridging computing and electrical engineering, agriculture, biodiversity, environment, and health. Antonio has created and led pioneer research groups in Brazil on agricultural automation, biodiversity, and computing, and more recently on planetary health. And he sees this as a natural evolution, one of broadening the scope of complexity of the problems that need to be solved to safeguard our future. He is currently the head of the Planetary Health Group at the Institute for Advanced Studies at the University of Sao Paulo. Welcome, Antonio.
Thank you so much, Jeremy, for your kind introduction. I'm so pleased to be here in the second day with this wonderful group of 4 ladies, amazing work they have been doing. And so I'm very pleased to moderate this session and hear and learning from them. I'll just comment that as we saw, and you have just mentioned that values are a fundamental pillar for planetary health and for achieving the great transition, a change in many aspects of our lives. We also saw how important traditional knowledge and faith tradition are to connect or reconnect ourselves, with our values, and with each other and with the planet. Another fundamental pillar is science and education, of course. Our academic institutions, which are responsible for creating knowledge through research that will inform decisions, and are also responsible for educating and forming citizens and professionals, are usually organized under a disciplinary structure. While planetary health science and education requires a transdisciplinary academic environment and a systems approach. Does that affect the careers of faculty and students' opinion, options, and formation? In this panel, we want to discuss those issues, and we'll bring good examples of institutions that are implementing innovative and comprehensive planetary health programs. So I'll start by introducing my colleagues here. So first, I would like to introduce Corrine Reed. Professor Corrine Reed is Provost, Deputy Vice Chancellor for Research and co-sponsor of the Planetary Health Initiative at Victoria University in Melbourne, Australia. Good evening, Corinne. Corinne is committed to place-based solutions to global challenges, co-designed with local communities, students, and Victoria University staff. It's amazing to see, because for Corinne it's good evening, but for others it's good morning or good afternoon. So that's part of this wonderful connection that we have. Then I'd like to introduce you Agnes Binagwaho. Professor Agnes is the Vice Chancellor and co-founder of the University of Global Health Equity. She's a global health fighter and she was named among the 100 most influential women in Africa. Before that, she worked in various high positions in the public sector in Rwanda, including 5 years as Minister of Health. Good afternoon, Agnes.
Good afternoon.
Professor Connie White Delaney. Professor and Dean. Professor Connie works at the Population Health and Systems Cooperative at the Institute for Health Informatics, University of Minnesota in the US. She's Professor and Dean of the School of Nursing at the University of Minnesota. So for you, I guess it's good morning, Connie.
Mm-hmm.
And then Melvine Otieno Anyango. Melvine is a Planetary Health Alliance Next Generation Fellow, working to inspire, activate, and convene campus ambassadors from around the world, as well as conduct outreach to facilitate both local and international collaborations. She's the founder of Planetary Health Eastern Africa Hub, and also a member of the Women Leader for Planetary Health. She has a background in environmental biology and health, and currently finalizing her Master's in Environmental Health at the University of Eldoret. Good afternoon, Melvine.
Good afternoon, Antonio.
I guess I have made it right in terms of the time you are right now. So I'd like to invite Corinne for her initial words.
Thank you, Antonio, and it's wonderful to be part of such an amazing panel. It's been a really exciting time at Victoria University over the past 18 months as we've made a whole of university commitment to planetary health. This is an action that emerged from many conversations with our academic and professional staff, our students, and our local communities. We are mainstreaming planetary health. It's required the support of our Chancellor, Vice Chancellor, University Council, Academic Board, research leaders and deans. We're just a small university and not a wealthy university. We're publicly funded and located in the communities in Melbourne's west that have a strong industrial heritage and have faced many challenges associated with economic and social disadvantage. We realised, though, that there were many of us at Victoria University and in our communities who were determined to change the legacy that we're leaving future generations. This has been brought into even sharper focus by COVID-19. However, we also realised that we live in a place where our Indigenous communities have been committed planetary health custodians for more than 50,000 years and bring great wisdom to what is being described as the Great Transition. I'd like to take this opportunity also to acknowledge and pay respects to the Boonwurrung and Woiwurrung elders and families of the Kulin Nations, the owners of the lands on which I'm speaking today, and also of the many Indigenous communities around Australia and around the globe who are bringing rich insights to our conversation today. The question we asked ourselves at VU is, can we make a difference? The answer we came to is yes, we can, but we need to be all in, students, staff, and community side by side. We're heavily guided by Nelson Mandela's conviction that education is the most powerful weapon which you can use to change the world. So how to proceed? We realised that we would need to reimagine the way that universities work to support our graduates to become the next generation of leaders in planetary health. We've pledged to incorporate planetary health thinking across our 4 pillars of research, teaching, campus operations, and community engagement. This has allowed planetary health to be a conversation that we're having together every day in everything that we do. So planetary health is very much at the centre of things. It's represented as a core pillar in our university strategic plan. It's in our decision making. We've become very fluent at asking, how does this action bring us closer to planetary health? Is it the best we can do in procurement decisions, in policy, investment, staffing appointments, and creating progression pathways for our staff? In our actions on campus, it's made us more bold so that our students can be immersed in planetary health, to live it and breathe it when they come to class. It drives our educational innovation, not just in what we teach, but in how we teach. We're working to infuse planetary health in all discipline areas, from the arts to the sciences, law, business, and importantly, transdisciplinarity is at the heart of our innovative first-year college model. We've also made a commitment to undertake high impact research by bringing together transdisciplinary communities of practice around sustainable futures and stronger communities, and by bringing industry and community and government partners into our projects. In all areas, we're also committed to being an active member of the global academic village. And I'd like to show you a short video now of how planetary health has come to life in our first year at VU. I'm going to try and share my screen. In 2020, Victoria University made a commitment to make planetary health core to everything we do. We're building a community that is making a difference to local and global planetary health challenges through research with impact, through learning that creates future leaders, through the sustainable choices we make, the way we work on our campuses, and through engaging with our communities to find innovative solutions to complex planetary health challenges. Place is important in finding solutions that will stick. We take a place-based approach, emphasising the importance of context and focusing on co-designing socially equitable local solutions. There are 3 foundational places for VU. Our role as the University for the West of Melbourne, our place on Aboriginal country, and our responsibilities as a global citizen. As a university community, we must walk the talk so that we're creating a sustainable university. We're shifting to 100% renewable power by 2021 and aim to be 100% carbon neutral by 2025. We are creating a rooftop living, research and teaching lab at Footscray Park. We're working with retailers to phase out single-use plastics. Student-led initiatives are focused on making all campus spaces welcoming, inclusive, safe, resilient and sustainable. Students are also actively engaged in sustainable projects, including this initiative transforming recyclable materials into construction materials. This year, planetary health became a strategic project for VU. We started big with a research investment of $1 million.
We want to work with Aboriginal women in the west of Melbourne. Many Aboriginal women don't have a connection to their traditional owner language groups, don't have connection to country, and could also be part of the stolen generations.
So let me tell you a bit more about eDNA that we might find in soil samples like this.
25 projects were funded involving 88 VU researchers and 42 external partner organisations. Our researchers are supporting resilience in bushfire-affected communities and working with youth to respond to mental health needs in light of COVID. We followed up with a brand new Australian-first graduate certificate in planetary health.
When I saw the advertising for planetary health, for me it resonated straight away as something that could give us a new vocabulary.
We can respond quickly and produce and deliver the courses people need in uncertain times, thanks to our block model and the VU way. We will work with our students, professional and industry bodies, and our community and global partners to have the courses and opportunities for tomorrow's world today. We have a shared passion for creating a strong future for the communities of the west of Melbourne and beyond. This year, with the support of VU Innovations and sponsorship from the Sid and Fiona Meyer Foundation, the Beta Pre-Accelerator program was launched and was dedicated to supporting the next generation of startup businesses committed to tackling planetary health challenges. In 2021, VU will prioritise making planetary health core to everything we do on our campuses, in our research, in our courses, and in our community engagement. With planetary health, VU is future ready. We hope. I'm very much looking forward to being part of today's panel discussion, and I'll hand back to you, Antonio.
Thank you, Corinne. Wonderful and inspiring to see that. So let's move and then have Agnes saying her initial words, maybe saying what is that you're doing at the University of Global Health and Education.
Thank you, Antonio, and thank to Corinne for this beautiful and instructive video. And thank you, all of you, for having me. So if the past year has taught us something, it's how much our health as human is interlinked with the health of our environment and animals, meaning the overall health of the entire planet. We have today all over the world to respond to COVID-19 pandemic, but while dealing with the virus, we continue to see more and more countries dealing with wildfire, floods, hurricane, and other weather-related disasters around the world. A prime example is what is happening now in many parts of the world and some parts of sub-Saharan Africa, where many communities continue to experience extreme weather events that push them to migrate. Many scientists and policymakers have warned all of us that environmental change are forcing people to live in precarity and to move from place to place, especially the vulnerable community who are not supported or equipped to deal with this challenge. In 2018, the World Bank estimated that there will be 143 million more climate migrants by 2015, coming from Latin America, Sub-Saharan Africa, Southeast Asia, compared to 2017, where 68.5 million people were forcibly displaced, and 1/3 of these people were displaced due to flood, drought, and storm. And we enter now in a period where we see more and more suffering than at any point in human history. However, we know that environmental consequences do not affect only people in silo, but these consequences are exacerbated by economic and political situation. In order to respond to this challenge, academic institutions like UGHE, my university, the University of Global Health Equity, need to train scientists and global health professionals who are leaders and are ready to not only deal with clinical and medical consequences of environmental outcomes, but also to advocate and implement socioeconomic policies that are favorable to the health of their communities and our planet. Not only for themselves, but essentially for the most vulnerable and the next generation to come. We also need to educate health professionals that can in turn educate communities members on good behavior and practice about the effect on environmental change and their health, as well as advocate for evidence-based intervention that integrate environmental health and community health at the local level and primary care level. For example, there is a large number of people lacking access to clean energy and result of cutting down the trees where they live to survive, while we have wealthy, very rich people greedily decimating the Amazon and African tropical forest. Moreover, the indirect effect from climate change faced by poor people is associated with the direct effect of pollution. It is estimated that 4 million people die every year prematurely due to air pollution in their home because of burning solid fuels such as wood, crops, residues, or sometimes coal. While about 50% of children die under 5 of pneumonia due to household air pollution. Students and researchers we train at academic and in other academic institutions can leverage planetary health courses to influence national and local policies and air pollution and clean energy to minimize and address health-related risk. This is also an opportunity for developing innovating, cost-effective, multidisciplinary, and multi-sectorial solutions that can be used as alternative to solid fuel burning to promote clean household energy used and to promote solutions that contribute to human development without penalizing vulnerable. At UJG, One Health is a cross-cutting issue in all courses. All students take the courses of One Health and we have also developed a One Health scholarship that promotes and equips future leaders with an interdisciplinary perspective on global health that focuses on the link between human, animal, and environment health. Our students explore complex global challenges through a holistic understanding of how a person's environment is part of its overall health. The students in medical field take also that course and are asked to learn how to bring together these different lessons from different disciplines and turning in practice in the field where they will work. We also know that planetary health consequences usually disproportionately affect the poor and the vulnerable population. So at UJG, because we have equity as our pillar, University of Global Health Equity, we equip our students with skills that will ensure that they will work to ensure that no one is left behind. Thank you. Back to you, Antonio.
Thank you so much, Agnes. I would like to listen from Connie now.
Thank you, Antonio. And first of all, on behalf of the School of Nursing at the University of Minnesota in the United States, I want to extend the deepest gratitude to each of the panel, the opportunity to participate, and most significant to everyone that has committed to the Planetary Health Alliance and our it's not just a commitment. I think we all know deeply we are changing the world. Sam, thank you. Several years ago, Sam visited the University of Minnesota during the ICOMOS International Conference related to One Health. And Sam, that was a defining moment. That deeply instilled and to this day continues to expand School of Nursing commitment to planetary health. Let me share just a couple comments. First of all, we are very committed to planetary health. Planetary health is a part of the School of Nursing strategic plan through. We designated a director of planetary health, Teddy Potter, and do everything we can to support and expand not only her engagement, but her engagement with all of us and expanded leadership. That commitment to planetary health continues to expand not only throughout the University of Minnesota, but also expanding to include a large number of nursing programs in the United States. So the commitment is deep. When I share that the commitment is deep, there are two particular comments I'd like to make before moving on to a couple other areas. The first is we talk about us being, you know, all part of humanity. And we talk about each of us. And you know, at the end of the day, it actually is about community. It's actually about a one community. So in the school, we think in and we value in that way. We connect head and heart with every deliberation that we make, commitment that we make. We ask, does this advance planetary health? But most profoundly, it is about us as a one community, a connected head and heart from local around the world. That influences every decision we make, including how it is that we share food with one another and what that food is, to all the other aspects of planetary health. So the one community is what we're about, and the connection of head and heart. That leads me specifically to make a couple comments about an area we'll talk more about in this panel, and that is how we advance education, how we advance scholarship. Again, we do it from a connected head and heart. Many times our science has been driven so much by our heads, and our decisions, economically and otherwise, by our heads. We are about being driven through a common head-heart connection, our common humanity. Many of you have joined us around the world, particularly through the last year. Inclusivity, diversity, and equity have been a key call for attention and action, not only in Minneapolis, but around the world. And I particularly mention that because, as my colleagues have already commented, the import of diversity, inclusivity, and equity to planetary health is deeply core also to who we are. The University of Minnesota School of Nursing, we've committed resources to not only integrating planetary health throughout the curricula for all levels, but we've also committed resources to research and discovery. Throughout the University of Minnesota, particularly in the health sciences, we are committed to transdisciplinarity. We're a space of, we think together, we discover together, we provide care together. So that also means that we have a profound relationship and partnership with our clinical environments. With these comments, I'd like to conclude by highlighting another fundamental principle that undergirds everything we do in the School of Nursing and our commitment to planetary health. We do not believe in competition. We believe in knowing, sharing, listening about everything we know, and partnering to advance the whole. We do not believe in competition. I thank you for the opportunity to offer these brief comments and look forward to the rest of our panel discussion. In gratitude.
Thank you so much, Connie. Very much inspiring as well. Melvine, I'd like to hear you for your initial words, please.
Thank you so much, Antonio, and I'm happy to be part of this panel discussion. I would just like to echo what Corinne had mentioned earlier, that planetary health as it is has a tendency of attracting category of people from diverse backgrounds and culture, social science, engineers, medical practitioners, laws, creative arts, and it is important to use art, for example, music and dance, as it has a powerful tool for communication. So I would also like to thank the Planetary Health Organization for offering students a yearly leadership opportunity as a Planetary Health Campus Ambassador to work on this leadership program beyond their campus and their communities. So, and all these students are leading in their various institutions and also implementing a number of activities. Just to mention a few from the University of Eldoret is that they've been able to strategize a way to communicate planetary health in their local community by engaging local wetland conservation, solid waste management efforts, and also participating in planetary health education through attending online lecture series and also attending webinar meetings. And also another way is to synergize One Health in their activities. Just to narrow down to academic career, we see that the careers are influenced a lot more by the employment opportunities. But this employment has been historically associated in gaining livelihood. So if we are not able to influence employment that favors or enriches planetary health policies or activities, then the subject of planetary health becomes difficult in a community or a region. So it is important to enhance advocacy of planetary health, especially among policy. So we need to design a way that makes advantages or requirements of planetary health, that makes society in general to understand needs, and once we see that there will be a set goal to achieve them, this will in turn create job opportunities for people. So concerning that, I also like to echo on that policy advocacy requires concerted efforts. And if that is not done, then there will be no need for policy change. For example, here in Kenya, Africa, when the law for environmental impact assessment was passed, it created jobs and it became a requirement. So for careers, we also need that support by the laws and the policies. But on the positive side, in my country, we see that we have support in even our constitution for sound environment and also things that favor planetary health. So there is urge to emphasize on working on policy, and at least planetary health has a key role to play in packaging planetary health activities of theory and knowledge in a manner that is understandable to the policymakers for transformative action. So just to talk more of alignment of planetary health curriculum, we find out our institutions have been holding a traditional structure of educating people to go to school. Perhaps after that, they go to their classes. Then there is a number of unit of coursework followed by assignments, then exam. And this structure is used in most countries worldwide. But we find out that a new structure will be very hard to make, but we can opt to come up with a structure that helps in changing a number of things, since planetary health is not just about knowledge alone, but it's action-oriented, resulting to a better planet. So for action, we require changes in our attitudes and perception, especially in our culture. For example, I like giving this example. For example, if you have a good car, it is perceived as good, and yet if you have also a bicycle, it can be better in some cases. But with this perception differs a lot. So what is the new approach? We can influence an approach that inculcates change in attitude, especially, and then that is very helpful for planetary health, so that we can go in depth from knowledge of theory to practice. Thank you a lot, and I'm looking forward to further discussion.
Thank you so much, Melvine. And I'd really would like us to start a conversation more than everything else. For you that are listening to us right now, I would just like to tell that we had a previous conversation 1 week or two ago, and it was just amazing. I told them that I wish that we had recorded it, because it was already very interesting. So, and we'll have questions from the audience coming up soon. I know we have some of them already there. But I'd like to ask you one question, and Reid would like us to talk about that informal manner, probably addressing two things based on what you have just brought. One is that when we think of implementing planetary health in an institution, university, one thing that we can think of is, well, we need to change structure, like curricula, courses, education. And the other is, again, in terms of structure, faculty, careers, departments, how they're assigned. One thing that I think can be a problem sometimes in terms of career, that issue of you having a disciplinary background and being evaluated on a discipline oriented basis, even the publications, everything else, at least that's what happens here in Brazil. And if you try to stay away from that, you may encounter problems in terms of, or you're publishing in another area, so that will not count for us, for our department, for instance. So the career may be a problem. So one aspect will be that one, in terms of the hardware thing of that, the structure that we probably think that needs to be changed. But then, taking into account what I have heard from you, we have a much softer approach and a deeper approach to that, which would be, I would say, like walking the talk. So planetary health is about much broader issues, much deeper issues, in probably much more important issues. And taking the words, the walking the talk, like Corinne said, or heart, head connection, not competition. Yeah. So this is different aspect. You don't change that by changing structures or careers or courses. I think maybe it's by example or by allowing people to work differently. So how to address those two things? How did you address that? Or how are you addressing that? What are your thoughts about that? And I leave it up to you, whoever wants to start with that.
Can I start?
Yes, please.
Okay, so those structures are actually ideal for the university. And for example, life has so many things, like we find out families will stay as a family for organizational purposes, for stability and order. So this should also be inculcated in university, which in other words, the faculties can also be organized and can also focus on transdisciplinary. So we can come up with a way of leveraging technology now that COVID-19 has really impacted a lot in the institution and affected them. So by leveraging technology, we can come up with virtual activities that address planetary health. And also, if we go from university and get degrees, and for example, if there is no grades, we socialize in culture of also different nations. And this is experiential learning. So my question comes in this way: can planetary health come in a culture that is packaged in a manner that it becomes practice, knowledge, and also an attitude to address these scenarios so that we can all gain? Because as we can see, that planetary health can be in turn be a religion and influence people's life through music, art, and dance. So I think that also can be synergized in institutional level through the shared values. Thank you.
Can I perhaps pick up on that as well, Melvine? What a great answer. And to perhaps stretch it even further, that really perhaps part of the responsibility and opportunity lies beyond our individual institutions as well. And this gathering that we're part of has been a fantastic example of really creating a global academic village for planetary health. I think for many of us who've been part of the conversations in the last couple of days and in the days ahead, we'll go back to our institutions quite inspired by the possibilities and a bit more informed about some other alternatives that we have. I think the gathering of the academy together around the world like this is a very powerful influence on determining what matters and changing the conversation about what matters in academic careers. And so picking up again on what Melvine was saying, you know, there is a cultural shift, a zeitgeist that is changing that we need to be alert to, tuned into, and to make sure that we bring it into our institutions to support planetary health moving from a niche area to a core business, to business as usual, for it to be embedded in our daily practice, in our way of thinking, in our language, so that it's not the exception but becomes the rule, and therefore changes to our structures and our processes and our policies become a next obvious step for us under those circumstances.
And Corinne, this is Connie. I would like to add to your comments that also tie back to Melvine's and Antonio's. You know, I'm thinking about I'm going to say simple things, although I know they're not simple. Something like promotion for faculty and how faculty are recognized and awarded. Share just a couple comments. In our school, when someone becomes part of our community, we are very explicit that this is a partnership. This is not about, hope you're successful. This is about, we will work together for mutual success. We hire a variety of persons that are not prepared in nursing, but they are of nursing and healthcare mindset. And we are all enriched by the depth and the breadth of these phenomenal dialogues. I was also reflecting on my role as a dean and the choices I make every day about what is recognized or lifted up and what isn't. So if I might be so crass to say, in our school, we do not lift up single stars, people that are one and only stars. We lift up people who are part of a one community, and as one is lifted, all are. I was immediately also reflecting on this business of competition. So if one starts, as we do in the school, from a value of abundance, we start with abundance, and then we engage together in how that abundance is shared for all. Thank you.
So much has been done. I have no much to add, and I agree with my fellow sisters here from so many places in the world, and we have the same ideas. I just want also to add that such a gathering, it's an occasion of networking. And networking is so important to boost our appetite to change the world, because we know that we are not alone, and it's so important also to learn from each other and to benefit from all the new knowledge or old knowledge recovered, because the traditional knowledge are so rich, and exchange about that. But not only it's important to have institutions inside universities that are teaching One Health or planetary health, it is important to embed that in all courses, everywhere, because it concerns everything. It doesn't have to be something that is important. Yes, we have an institution of One Health at UJG, but all courses, even in gender, in nursing, in anything, even in all executive courses we give to anyone coming to learn any type of skills, related to health clinical service delivery or to health program management. We teach the principle of planetary health. And that's the only way to change things rapidly. If we do that in 10 years, 20 years, it's going to be like an alphabet of life, and everybody will implement that.
Thank you so much. And you can keep the conversation as you will, but I'll add a few points that have been raised here by the audience. So many questions coming up, of course. Such an interesting conversation. One would be, you come from different, Corinne is working at the university administration, Connie and Agnes as well. So one thing is, how do you do that from top-down approach and with the higher administration, either the university or the college, School of Nursing is taking the lead, and the other is bottom-up approach in which you have the faculty involved, the students involved or engaged. They're not necessarily, absolutely, they're not, they can happen at the same time. They're not exclusive. How do we deal and how do we work to have the higher administration engaged, for instance, what happened in your case, and the other way around, how do we have the bottom engaged, the students, the faculty, to adhere to that, and especially adhering to that broader concept, not only changing merely a curriculum, a discipline, for instance. This is one point. And I'll just throw another one so you can maybe answer according to what you want. This comes from the audience as well. Are we teaching, or how are we considering that we're teaching and informing people, professionals, for a profession or for a market that may not exist yet? What if that is true? I don't know. So how do we tackle that?
Perhaps I'll start, Antonio. For us in the past year, in terms of how to engage everybody in that conversation, it's really been demand driven. I've been amazed. I started out by thinking that I would invite a few people along, like-minded people, for a small conversation about planetary health. And what we found is that the auditorium filled, and it was in fact overflowing. There were people sitting on the stairs who were hungry for the conversation around what we could be doing to secure a better and stronger future for our families, for our students, for our communities. And so that the strength of that voice really encouraged us to push on. And it encouraged our executive to pay attention, to take notice and to hear the strength of that conviction that we needed to act and to be part of finding solutions. I think also when it comes to preparing for jobs that we may not know what they are yet, I think what we do know is the qualities and the values that are going to be critically important to our graduates, no matter what kind of job they take up. They need to be prepared for facing complex, challenging circumstances. They need to be prepared for working across disciplines and across cultures to address global challenges that are difficult and in some senses may feel intractable. We know that these are qualities that we need to develop in our graduates. I think our graduates will then help to determine what the shape is of those future careers that they will design and develop themselves to fit the needs that are emerging as the time. Even a year ago, who would have thought COVID could possibly have happened, or that we would need so many people in the healthcare field and the mental health care field to develop new niches and new ways of working through telehealth and other sorts of formats. So I think we perhaps don't need to get too hung up on what the future is going to look like in terms of particular jobs, but to be really committed to developing the right qualities in our people.
This is Connie and Corinne. Thank you so much for your comments. I will add just a brief couple. One relates to the market. As you and others are sharing, the world is speaking. And the demand for growing expertise, partnership, sense of community is unfolding right before us. As I think about the, if you will, evolution of the traditional evolution of disciplines and specialties, I actually only worry that the evolution of this specialty could occur in the traditional way. Meaning that right now we are welcoming the breadth of the inner relationship of everything. And how is it that we continue to learn together? How is it that we continue to hold our heart together? How is it that we continue to actually act, live, walk the talk, and not let the fragmentation happen? We're called to wholeness. Thank you.
Melvine, I can see you want to say something, so go before me.
Yeah, thank you. I just wanted to add, for our case in the University of Eldoret, we started off by just forming a Planetary Health Society club that enabled active students and interested students from different fields to be part of the planetary health community. And through that, they shared ideas and what kind of activities they wanted to do. For instance, a case scenario whereby where they are staying is very, very polluted. So they started off with an activity on solid waste management efforts. So with that, they ended up engaging the local communities and inviting them in a workshop where they discussed and strategies on way forward. And through that, it opened doors for more students to take part in that. At the same time, we ended up not only promoting that in our institution alone, but we ended up promoting planetary health in other institutions in Kenya. So that's how we started off, and I see it has really expanded now that we have also support for the Eastern African region, whereby majority of students have started forming a club of their own and doing these planetary health programs and implementing them. Yeah.
So to the first part of your question, Antonio, to just complete what my colleague have brilliantly said, I think that for me, I don't have a problem because it is in the definition of who we are. We are a university of health science, and we have a very few pillars. One of them is equity. The other one is One Health. And for equity, you have everything inside: diversity, inclusion, etc. And the holistic approach of human health that comprise planetary health. So when somebody apply to the university, they know what they apply for, and all interview take that in account. Of course, it's not the same. If you lead the nursing, you have that as a big addition. It's not like when you lead or you go to the Institute of One Health. But also we have this cross-cutting education. I told you medical students have to learn about One Health and understand that COVID is a typical disease due to that we cannot handle or we cannot prevent the next type of pandemic. The last 10 years, almost all the big health threats were linked to zoonotic. So because also we focus on the vulnerability of humans, what makes them vulnerable is a mismanagement of our planet. And it's not complicated to prove. And it's so obvious that we will insist in that in all courses. So the admin I think that university, even in administration, oh, but you say you believe I'm an admin. No, I'm a researcher and I'm teaching as well, and I'm the vice chancellor. So I have 3 parts in my my duties. But the admin, that means the head, the deputy vice chancellor in charge of administration and finance, know what it is, because we want them to know and to feel what it is, because when it is a matter to dedicate budget, we need their mind and finance to do that the best way to promote the program. So each and every one is part of it. Also, as an university, like Melvine said, we are very involved. We are the one who support, who advise the government in the we have an East community, let's say, coalition for One Health. All the institutes with global health or public health are almost part of it, and it has a say in designing the strategies in our different countries and the strategies of East African. So it's taking it high level in our region. It's discussed up to the East African Council of Ministers. And almost all the countries of the 5 countries of East Africa, meaning Kenya, Uganda, Tanzania, Rwanda, and Burundi, some later because they have political instabilities, but we have that. And it's more easy to find budget and to find teachers and to create department when we have the top leadership in health or education already convinced, signing at political highest level. What is the East African above the countries? To have that, we need to have it in countries. And for our students, it's up to us. If they don't feel it, we are bad teachers.
Different.
Thank you.
Thank you. Thank you so much. If you have some time, have 10 minutes or 12 minutes. So I'll try to mix some questions here, and also thinking that in our audience, and not only those who are watching us right now, we have 251 people here with us, but of course many more will watch us later on the videos. And we have different situations. Like, I'm from engineering, my school is School of Engineering, and we have other areas as well. And we all want to know from you how to do that. And I understand that in some ways, some of your examples are special examples, because you're already in health, for instance, Agnes, Connie as well. But nonetheless, of course, you bring powerful examples of how you did it, how you're doing that. But I want to draw on that to try to expand to other situations in which we don't have people from health area at the top, at the higher administration, or from education, or even if we do, they don't have the mindset yet, and they have to be convinced, or as Agnes said, or maybe not convinced, but they must fall in love with this idea more than being convinced, I think. They must embed that. So thinking from the side of the faculty, one question is, what are the incentives for young faculty which are not originally from the planetary health area, especially if they're not from the health area? What are the incentives for them to start working on that, when sometimes the barriers are existent in terms of career, of publications or promotions and so on? Even if it's not the case of your institutions, you know how other institutions work, so you might have an idea of how to deal with that. And the other point is also planetary health demands us not only to do research and education, but as many of you mentioned, outreach, action. We need to go out of our walls, our borders. That's crucial. How to do that? Because sometimes also the universities do not value that as well as education and research. Papers, the number of students, that's the most important thing sometimes. So this is one point. And the other is about the students. I understand that students, the youth in general, are the most powerful energy that we have now. Not only because they're full of energy by definition, but also because they, more than us, they want to change the immediate future, the present and the immediate future. So, and I think they must be more than ever empowered in our universities. So how are you doing that? And how do you think that has to be integrated with classes, with research, within university? So not simply as a, well, there's a student club, there's a student group. No, there must be a central part of that, I think. How do you think of that? What do you think of that?
Antonio, this is Connie, and I'll just make a couple quick comments. Thank you so much for the breadth of the question that you just asked. And I'd like to just thread a few parts to it. One is, as a specific example, our relationships among our partners in the world with the school. And all of those are permeated with interprofessional. Next, we made a decision in the school that we would fund the first 2 years of PhD education for anyone accepted to our program, no matter what country they come from. And the goal is also to support them through their current partnerships or home institutions, and that the ongoing support through the education process, but even more significantly, what happens after they graduate is our commitment. So I share that as just one tiny example of how, when you don't believe in competition and you welcome the abundance of the resource that we all have in one way or another, how we can share that with others and literally empower not just nursing, healthcare, planetary health in the world.
Thank you.
Thank you.
Perhaps I'll add something to Connie's comments. If we go back to where we began in this conversation, I think it gives us some of those answers that there is a virtuous circle here between the passion that a young scholar might bring for an area, or a commitment to addressing a particular challenge. And that's a necessary component of having a fantastic planetary health culture in an institution. And then our responsibility as the institution is to create the space, is to decide what we value, and to organize ourselves, organize our structures, our systems, our policies, to make sure that it is aligned with what we value, with the impact issues, rather than necessarily the traditional metrics of academic performance, and to make sure that we're in the front line of those conversations, that we argue purposefully and fiercely for the importance of these different ways of understanding success as an academic and as an academic institution. And again, if we go back to the potential power of the global academic village here, one example that I can talk about is a project that I'm involved with that began at the Global Health Academy at the University of Edinburgh when I was there. Has travelled with me to Victoria, involved our partners in Chile, in Malawi, in Nigeria. More than 200 researchers have contributed to conversations that have developed a global ethics toolkit to help us work differently around complex global challenges to do with planetary health. And together, all of that global academic village have come together to develop this resource to share with the rest of the global academic village. That has enabled many young scholars, as well as bringing together many senior scholars. And so it's really up to us to, within our institutions and to stretch beyond our institutions, to make sure that we are bringing to bear this commitment in every conversation that we have, in every area where we have influence, to change our ethics processes within our universities by joining with others around the world to agree on what it is that matters going forward in this new planetary health environment, to make sure that career progression takes into account the meaningful contributions that people are making to their local and global communities, and recognising that that may impact on traditional metrics in a negative way, but to have a counterbalance to be considered in that equation. So it's both what we choose to do individually, it's what we choose to do within our own institutions, and it's our absolute commitment to join together collaboratively rather than competitively, as Connie said earlier, to make sure that every conversation addresses this issue.
And also just to add on that, we think the youth in the academic have more chances to be learned and trained and to engage in implementing these planetary health activities. So as university, we need to ensure that the planetary health curricula are also influenced in all programs and faculties. And it should be integrated in such a way that it can be in different disciplines, and also this integration of knowledge and skills will be necessary for their transformational action. And it is very crucial to equip current and future leaders and also stakeholders on various domains with this planetary health knowledge. Thank you.
So again, a lot have been said. I'm just going to add that what we do with our students, first of all, we take advantage of their energy and their desire to change the world, and we teach them how to do it. First, we empower the student in their confidence and their managerial and leadership skills that will support the work they will do, and that will give them the confidence that they can be the smooth and efficient agent of change that is needed to really integrate the knowledge we give in the day-to-day life where they will be, and to improve the community where they live. So on top of the science, also the mindset and the capacity to do it. For what happened in multidisciplinary approach, that's true, it's not easy. And we need to convince the top university that the promotion, the career have to change and to be adapted. And COVID is a nightmare, a hell, but it's an opportunity. So if we don't say it, we are a little bit dumb. And we need to push for that. And also, I want to say that we are developing a report for UNESCO for how higher learning institution. We are not UJG. UJG is in Rwanda. So I am among a team of global experts that are doing a report for UNESCO, where all those things will be tackled. Interdisciplinary approach, collaboration, partnership, how to do that at high education level to reach the SDGs. And it's one of the major recommendations.
Thank you so much, ladies. It was a pleasure and an honor to be here with you, learning a lot. I'll listen to our conversation sometimes later again. We have to finish because the next session starts in 10 minutes, and I'll just like to mention that the next one is how to promote planetary health science and education, a funder's perspective, another very important point. So thank you again, and see you soon. Bye-bye.
Bye-bye.
Bye-bye. Thank you so much.